This is Alice and Michaela, Grace, and Lauren, and we're presenting the hip. The bones in the hip are the ischium, ilium, pubis, and femur. The ischium, ilium, and pubis all support body weight, whereas the femur can rotate around about 90 degrees at the hip joint. It can circumduct around 360 degrees as a circle.
The first feature of the ilium is the iliac crest. The iliac crest is a curved superior border of the ilium. It is located on the superior and lateral edge of the ilium. Many different muscles of the trunk and thigh attach to the iliac crest. Another feature is the iliac fossa. The iliac fossa is a shallow depression or hollow in the iliac region which creates the ball and socket joint. It allows for the head of the femur to rest within the pelvic girdle, which gives it the flexion, extension, abduction, and adduction movements.
The first two bone features of the ischium include the obturator foramen and the ischium ramus. The foramen is an opening or a passage that's located inferior to the pubis bone and just above the ischium. This allows for a place to house the blood vessels and nerves. The ischium ramus is an arm-like structure located in the pubis region as an origin for part of the adductor magnus muscle and the gracilis muscle.
The feature in the pubis is the pubic symphysis. This is located between the left and the right pubic bones, which is made up of cartilage and reduces friction between the bones and acts as a cushion during the movement.
The features of the hip bones include multiple spines. These are the anterior superior iliac spine, the anterior inferior iliac spine, and the posterior superior iliac spine. The anterior superior iliac spine is a bony projection of the iliac bone that serves as a point of attachment for the inguinal ligament and the sartorius muscles. The anterior inferior iliac spine is a bony eminence on the anterior border of the hip bone, or more precisely, the wing of the ilium. The rectus femoris muscle originates from the upper part of the spine, and the proximal end of the iliofemoral ligament attaches to the lower part. The posterior superior iliac spine is a bony prominence that serves as a point of attachment.
Bone features of the femur include the head of the femur, the fovea capitis, the greater trochanter, and the lesser trochanter. The head of the femur rests in the acetabellum. The fovea gives attachment to the ligament of the head of the femur. The greater trochanter is the point of attachment for a number of muscles, and the lesser trochanter receives the insertion of several muscles.
Some important ligaments that hold the hip together and the role they play are the ischiofemoral ligament, iliofemoral ligament, and pubofemoral ligament. The ischiofemoral ligament is posterior. It connects the ischium and the femur together. It's a band of strong fibers that hold together the ischium and the femur and prevents hyperextension, and it's a spiral orientation. The iliofemoral ligament is at the anterior surface of the iliac spine, the intertrochanter on the femur. It's Y-shaped. It prevents hyperextension of the joint. The pubofemoral ligament expands between the upper portion of the pubis and the intertrochanteric line of the femur, and it also has a triangular shape, and it prevents excessive abduction and extension. More important ligaments that hold the hip together are the acetabellar labrum and the ligamentum teres. The acetabellar labrum is superior to the femur, and it's a cup-like depression. The ilium, ischium, and pubis all form it, and this is where the ball and socket joint go into, and it's made up of fibrous cartilage. The ligamentum teres is a round ligament that surrounds the head of the femur. It's triangular in shape and somewhat flattened. It's made tense when the thigh is semi-flexed and the limb is abducted or rotated outward. It's relaxed when the limb is inducted or rotated inward.
A muscle that is important to the hip joint is the gluteus maximus. The organ spans the posterior gluteal line of the inner upper ilium to the posterior surface of the lower part of the sacrum and the side of the coccyx. 2 points of insertion are the iliotibial band of the fascia lata and the gluteal tuberosity between the vastus lateralis and adductor magnus.
The gluteus medius has an origin that spans the outer surface of the ilium just below the crest. The insertion is at the greater trochanter.
The gluteus minimus has an origin point on the outer surface of the ilium beneath the gluteus medius. The gluteus minimus has an insertion point on the greater trochanter of the femur.
Tensor fascia lata. The origin is the anterior lip of the iliac crest and the anterior superior iliac spine, and the insertion is inserted between two layers of the iliotibial band.
The piriformis origin is the anterior region of the sacrum, and the insertion is the greater trochanter of the femur.
The origin of the gracilis is the lower half of the pubic symphysis and the upper half of the pubic arch. The insertion is the upper medial shaft of the tibia.
The rectus femoris has an origin point on the anterior inferior iliac spine and the rim of the cerebellum. The insertion point is at the base of the patella.
The sartorius origin is the anterior superior iliac spine, and the insertion is the medial surface of the proximal tibia.
The iliopsoas is made up of the psoas and the iliacus muscles. The psoas has an origin point along the vertebral bodies of T12 and L1 through L3. The iliacus has an origin point on the iliac fossa. They both have an insertion point on the lesser trochanter of the femur.
The hip extension prime mover is the gluteus maximus. The antagonists are the iliopsoas, the tensor fasciae latae, and the sartorius. The synergist is the biceps femoris.
The hip flexion's prime mover is the psoas, the antagonist is the gluteus maximus, and the synergist is the iliacus, the tensor fasciae latae, the rectus femoris, and the sartorius.
The hip internal rotation's prime mover is the gluteus minimus, the antagonist is the gluteus maximus, gluteus medius, and sartorius. The synergist is the gluteus medius, tensor fasciae lata.
The hip's external rotation's prime mover is the perifemoris. The antagonists are the gluteus medius, gluteus minimus, tensor fasciae lata, and the synergists are the gluteus maximus, gluteus medius, and sartorius.
For hip abduction, the prime mover is the gluteus medius. The antagonists are the adductors, and the synergist is the gluteus maximus, the gluteus minimus, the tensor fasciae lata, and the sartorius.
For hip adduction, the prime movers are the tensor fasciae lata and the gracilis. The antagonists are the gluteus maximus and abductors. The synergist is multiple adductors.
The hip joints belong to a class of very mobile joints. However, mobility comes at the expense of stability. When comparing the hip joint to the shoulder joint, for example, the hip joint is more stable and less mobile. The factors that influence the stability of the hip joint are the ligaments and the joint capsule. Also, the mirror shape of the articular surfaces enhances the stability of the hip joint.
The hip joint is relatively prone to injury, especially fractures due to the constant stress on the joint and the thin bones found in this part of the body. The ball and socket nature of the joint can be overused from constant movement too.
There are a few common injuries and issues that occur with the hip. Some common injuries include broken or fractured hips, dislocations, hip strains, bursitis. Some common diseases may also influence joint issues such as osteoporosis or osteoarthritis. Osteoporosis of the hips causes weak bones to break easily, while osteoarthritis can cause pain and very limited motion in the hip.
The most severe restoration is to get hip surgery or total hip replacement. In this case, the damaged hip is removed and replaced with a prosthesis. This is usually an option when joint damage interferes with function and causes constant pain that is not alleviated with other therapies. Those therapies include medications to alternative pain relief, inflammation, slow bone loss or prevent further joint damage, as well as exercises to maintain the range of motion and to strengthen the muscles.
Thanks for listening. We hope you learned something.